What if the biggest mistake you could make with numb, burning, or tingling feet is simply stopping movement altogether? Neuropathy can make your feet feel strange, weak, or unreliable. And when walking starts feeling uncertain, many people naturally move less. But less movement can create another problem: weaker muscles and less confidence. Today, I'll show you 6 gentle movements designed for older adults who want to keep their legs active without turning exercise into a punishment. Picture a 71-year-old woman named Linda. She used to walk around her neighborhood every morning. Then her feet began tingling. One day she stumbled slightly while stepping off a curb. Nothing serious happened, but it frightened her. After that, she stopped taking her morning walks. A few weeks became several months. Her feet weren't necessarily better. Instead, her legs felt weaker, and she became nervous about walking farther than her front door. As a senior health exercise educator, I want you to understand something important. This routine isn't about promising to cure neuropathy. Neuropathy can have many causes, including diabetes, certain medications, nutritional problems, alcohol exposure, and other medical conditions. Exercise cannot replace finding and treating the underlying cause, but appropriately chosen movement can help you work on strength, mobility, coordination, and confidence. And those are extremely valuable when your feet don't feel completely normal. Think of your feet as one part of a communication system. Your nerves send information between your feet, legs, spinal cord, and brain. When sensation is reduced, your brain may receive less reliable information about pressure, position, and movement. At the same time, avoiding activity can reduce the strength and coordination you depend on for walking. That's why the goal isn't to attack the numbness with one magical exercise. The goal is to keep the movement system as capable as possible. But please don't interpret that as push harder. With neuropathy, safety becomes even more important because reduced sensation can make injuries harder to notice. You should not exercise through severe pain, dizziness, chest discomfort, unusual shortness of breath, or sudden weakness. And if you have significant balance problems, foot ulcers, severe loss of sensation, or another serious medical condition, get professional guidance before trying new exercises. For today's routine, you need a sturdy chair, comfortable clothing, supportive footwear if appropriate, and a clear space around you. Keep a countertop or another stable surface nearby for exercises that involve standing. Don't use a chair that rolls. And if you cannot safely stand without assistance, stay seated and choose the seated versions. The goal isn't to prove what you can tolerate. The goal is to create a routine you can repeat safely. Let's begin with a simple movement that wakes up your lower legs without requiring you to stand. Sit tall with both feet flat. Slowly lift your toes while keeping your heels down. Then lower your toes and gently raise your heels. Continue moving between those two positions. Don't rush. You're practicing control at the ankle while giving your lower legs some movement. If the range is tiny, that's completely fine. Small and controlled beats big and careless. Your ankles are involved in almost every step you take. They help your body respond when your weight shifts forward or backward. When they become stiff or weak, walking can feel less smooth. This exercise is not a treatment for damaged nerves, but it gives you an easy opportunity to practice ankle movement while seated. And because you're not worrying about standing balance, you can concentrate on the motion itself. Now place your feet comfortably on the floor. Keep your heels down and gently try to spread your toes apart. Hold for a moment, then relax. Try again. You may discover that your toes don't respond exactly the way you expect. That's okay. Don't curl them aggressively. Don't force them. Simply attempt the movement. The goal is to practice awareness and control of the small muscles in your feet, not to create a dramatic workout. Why spend time on something that looks so small? Because neuropathy can make people pay attention only to the burning or numbness. Instead, we're also asking a different question. Can I still control this movement? That shift can be empowering. You may not be able to change sensation instantly, but practicing controlled movement gives you something active to work on. Over time, small abilities can become part of a much bigger movement routine. Next, sit toward the middle of your chair with your feet on the floor. Slowly slide one foot forward, allowing the knee to straighten slightly. Then slide it back underneath you. Switch legs. Imagine your foot is moving across a smooth floor rather than being lifted into the air. Keep the movement comfortable and controlled. This gives your knees, hips, and ankles a chance to move together rather than treating your foot as if it exists separately from the rest of your leg. Think about what happens every time you get out of a chair. Your feet move. Your knees bend and straighten. Your hips shift. Your body has to coordinate all of it. That's why exercises that practice connected movement can be useful. You're not training for a fitness competition. You're rehearsing pieces of the movements you need to walk across your kitchen, stand at the bathroom sink, or move from one room to another. Now, if standing is safe for you, stand behind your sturdy chair and keep both hands available for support. Keep your feet comfortably apart. Slowly shift a little more of your weight toward the right side, return to center, and then shift toward the left. Keep your movements small. Your shoulders should stay relaxed. Don't lean dramatically. You're simply teaching your body to recognize controlled changes in weight while having something stable to hold. Walking isn't just moving one leg after another. Every step requires your body to transfer weight from one side to the other. If your feet don't provide reliable sensory information, that process can feel uncertain. Practicing controlled weight shifts gives you a low-level way to work on that skill. And here's the important part. You have the chair there. You don't need to test your balance in the middle of a room. Stay behind your chair and hold the back with both hands. Place your feet comfortably apart. Now gently bend your knees and move your hips slightly backward, as though you are beginning to sit down. Then return to standing. You only need a small movement. Think controlled, not deep. If standing from a chair is already difficult, make the movement extremely small or skip it until a professional shows you an appropriate modification. This movement focuses on a skill you use constantly, controlling your body when lowering and rising. Stronger legs can make everyday tasks easier, but strength is only one piece of the picture. You also need coordination and confidence. Now return to your chair. Sit upright and place both feet securely on the floor. Lift your right hand and gently tap your left thigh. Then switch sides. Right hand to left thigh, left hand to right thigh. Keep the movement slow at first. If your legs are comfortable, you can slightly lift the opposite foot as you tap. But don't make the movement complicated. The purpose is to practice coordination between opposite sides of your body. Your nervous system constantly coordinates information from both sides of your body. When you walk, your opposite arm and leg naturally work together. When you turn, reach, or step around an obstacle, your brain has to organize multiple movements quickly. A simple crossbody pattern gives you a safe way to practice coordination while seated. If you find it confusing, slow down. Accuracy matters more than speed. Here's one mistake I want you to avoid. Assuming that stronger exercise automatically means better results. If your feet are numb, you may not notice rubbing, pressure, or a small injury as quickly as someone with normal sensation. That means more intensity isn't automatically smarter. Start with gentle movement. Wear appropriate footwear. Inspect your feet regularly, especially if diabetes or significant sensory loss is involved. But there's another extreme. Some people become so worried about neuropathy that they almost stop moving. They sit for hours because they don't trust their feet anymore. That can create its own cycle. Less activity can mean less strength, less confidence, and more difficulty performing ordinary tasks. You don't have to choose between doing nothing and doing a difficult workout. There is a middle ground, controlled, gradual movement. Now I want you to think about your own experience. Which part bothers you most right now? Burning, tingling, numbness, weakness, or feeling unsteady when you walk? And what everyday activity has become harder because of it? Tell me in the comments. Your answer could help another senior watching this realize they're not the only person dealing with the same frustration. If you have ongoing neuropathy, don't just ask, "What exercise should I do?" Ask a more useful question. Why do I have neuropathy? Ask your doctor whether your blood sugar needs attention, whether medications or nutritional deficiencies could be involved, and whether your balance and sensation should be evaluated. If your walking has changed significantly, a physical therapist can also help determine which exercises are appropriate and how much support you need. For your first week, you don't need to perform everything perfectly. You could begin with 5 minutes of seated movements. Then gradually add supported standing work if it's safe for you. Pay attention to how your body responds. The goal is consistency, not exhaustion. If you can perform a few minutes today and return tomorrow feeling capable rather than destroyed, you've created something much more useful than a workout you can only tolerate once. Here's a simple way to remember today's routine. Start seated with ankle movement and toe control. Add a gentle leg movement. Then practice coordination. If standing is safe, add supported weight shifting and a small sit-back movement. Finish seated. You can repeat the sequence slowly and adjust the amount of time based on your ability. And remember, if one exercise doesn't feel right for your condition, it doesn't have to be part of your routine. Neuropathy can be frustrating, but a diagnosis doesn't automatically mean your future has to become smaller. There are many things you can still work on: strength, mobility, balance strategies, footwear, blood sugar management when relevant, and safe physical activity. You may not control every part of the condition, but you can often influence how prepared your body is to move through daily life. Think back to Linda from the beginning. She didn't suddenly wake up one morning with perfect sensation in her feet. Instead, she started with seated movements because standing made her nervous. After several weeks, she felt more comfortable practicing supported movements near her kitchen counter. Eventually, she began taking short walks with someone she trusted. Her neuropathy didn't disappear overnight. What changed first was her confidence, and that gave her a reason to keep moving. Remember this: you don't have to defeat neuropathy today. You simply have to give your body one safe reason to move today. One controlled movement may seem insignificant, but repeated hundreds of times over weeks and months, small actions can become habits, and habits can protect the abilities you still have. Before you finish, look at your feet. If you have reduced sensation, make foot checks part of your routine. Look for redness, blisters, cuts, swelling, pressure areas, or anything unusual that you might not have felt during exercise. And if you notice a wound that isn't healing, significant swelling, a new weakness, or a sudden change in sensation, don't simply exercise harder. Get medical advice. Let's make today's 6 movements easy to remember. First, seated heel-to-toe rocking. Second, gentle toe spreading. Third, seated heel slides. Fourth, supported weight shifts. Fifth, a small supported sit-back. And sixth, seated crossbody taps. None of these movements requires a gym. None requires expensive equipment. And each can be scaled down to meet you where your body is today. If you currently have neuropathy, don't compare your movement to someone else's. Your starting point might be 5 minutes. It might be one exercise. It might mean holding a chair with both hands while another person needs only one. That's okay. The goal is not to look impressive. The goal is to keep building the safest amount of movement you can realistically maintain. If you're willing to give your feet and legs a little more attention this week, comment, "I'm starting." And if you know someone over 60 who has stopped moving because neuropathy has made them afraid of falling, share this video with them. Subscribe for more senior-friendly exercise and healthy aging videos that focus on practical movements, not complicated fitness routines. One final reminder: this video is educational and is not a personalized treatment plan. Peripheral neuropathy can have different causes, and the right exercise program depends on your medical history, sensation, strength, balance, and overall health. If you have severe numbness, foot ulcers, major balance problems, recent injuries, diabetes complications, or another significant condition, speak with your doctor or physical therapist before beginning a new exercise routine. Start gently, stay within your abilities, and prioritize safety every step of the way.